Hello, this is Don Nasca again. This is my second video in a long series of videos about Medicare. This particular video number 2 is about Medicare ABCs, which of course everyone needs to have some grounding and foundation before they move forward and do anything else with Medicare. Medicare A, B, C, and D is fairly easy to isolate into these parts. One is hospital insurance, Part A. Part B is medical coverage, which is everything that doesn't happen in a hospital. Doctor visits, outpatient services, durable equipment, lab services, images, that kind of thing would be Part B. Part C is private industry insurance. It comes through carriers that are approved by Medicare, and they offer you ancillary benefits, other things that Medicare alone would not normally be able to cover, including your drug plans, which also could be purchased as a separate plan, Part D. So you could have Part A and Part B with the federal plan, and you can buy a Part D plan to help cover your drug costs. I didn't mention Part A also covers skilled nursing facilities, which would be like recovering from an illness or injury, not needing hospital care, but needing some additional nursing level facility care. Hospice care is when we are deemed at the end of the road, and with 6 months or less to live, there are some additional benefits provided to us. And there are some home health care benefits, but that's a little gray and needs some more discussion. So we can go through these parts, hopefully quickly. Time moves quickly when you're trying to do a video. But Part A, when you look at the numbers, which you don't many times get to really see in any advertisements, the first 60 days in the hospital, you just pay the deductible. This deductible goes up every year, but it's about $1,500 now in 2022, $1,556. Not the end of the world. I've had family members just go to the emergency room. That one bill was $5,000, another was over $10,000 just for the emergency room. So it's a great coverage to have, and Medicare Part A is something we get simply by the nature of having worked in our lives. If you've worked for at least 10 years, it's free of charge. And there's a premium if you've worked less. I won't go into those details, but if you've worked at least 10 years of your life, you get Part A coverage, and you're in the hospital less than 60 days, you pay $1,556. Hallelujah. It's a great thing to have. 61 to 90 days, then you're starting to pay some coinsurance. God forbid you're in the hospital that long, but you could end up with a bill for $11,670. Still, for somebody in the hospital that long, it's not a big deal. For most people, you'd have to pay it off if you had no money, but again, it's coverage that wouldn't devastate most people. 91 to 150 days, the things start getting rough. Then you're up for $778 a day in 2022. And again, now you could be almost $47,000 due and payable for those 91 to 150 days. You got to add that to the 11,670 and the 1556 to get your total bill. So you can see, yes, this is becoming a burden if you're in the hospital a long time. And, people in Europe and Asia look at this like, huh? What are you talking about? Who's going to have that kind of money? That's the way it rolls in the United States. Anyway, more than 150 days and the bill is 100% yours, 151 days. And you can see what skilled nursing offering is. The first 20 days, you're in good shape. Hospice care, you're covered. Blood, first 3 pints. This is the graph everyone provides, but usually without the totals of what you have to spend if you find yourself in these situations. I won't read all these asterisks. You could have probably read it by now. So Part B is the medical coverage, as I mentioned. There is now a annual deductible of $233, fairly insignificant. Um, 80% is approved and 20% is out of your pocket thereafter. Can add up, obviously, depending on how many medical services you need. You can read the chart. I won't read it. The premium is $170.10 in 2022. It's gone up quite a bit. It was 148 and change, I think 148.50. So it's a sizable jump for people that are on a fixed income. Nonetheless, this is Part B. It's coverage for your doctor visits primarily and your imaging and such. So let's move on. Part A and Part B do not cover prescription drugs that are not administered in the hospital or a medical facility. You know, if you need infusions or IVs or something, different story. Then long-term care, such as a nursing home, hearing aids, most of your vision care, unless it's some kind of medically necessary, surgery or something, problem with your eyes. If you need glasses or contacts, no. Exams, no. Dental exams or cleanings or anything like that, no. Dentures, implants, things that most older people do end up needing, they won't be covered. Routine foot care, which seems odd, but boy, you would not believe how many people suffer with foot problems in their older years. Cosmetic surgery, that's a no-brainer, of course. At least to me, you wouldn't want the government paying for that. Massage therapy, alternative medicines, naturopath, that kind of thing. No. Sterilization, whatever, who gets that? I guess some people might need that or want that. Hysterectomies, unless it's medically necessary. Medical marijuana, and when you're outside of the United States. So this is a synopsis of things that aren't covered. Part D is your drug coverage, as I mentioned. Now, this is very complicated for most people. You have a Part D plan that you can buy. Generally, they're not very expensive, but every plan is different. If you get a Medicare Advantage plan, which is Part C, and it has a Part D plan wrapped in, it looks the same. You have this chart that tells you basically every drug that they happen to cover, and they were all different. Don't be fooled into thinking all drugs are covered and that all plans are the same. They're not. Every plan and every carrier is offering some different combination. How they arrive at these things is a science beyond my knowledge. But nonetheless, your drugs are put into tiers. You can see these 5 tiers, and as you go up in tier, generally the price gets higher. Your out-of-pocket cost goes up. And again, refer to the summary of benefits for any plan you're looking at. It will tell you precisely which drug is in which tier and what it will cost you to have a drug in that tier. And when you look to the right here, you can see there is a deductible phase up to $480. Some plans will cover all of it. You won't have any deductible. Others charge you the full amount. Again, you have to look at the plan, but there is generally a deductible period. And then as you spend on drugs, you move into the initial coverage period, which right now $4,430 is the maximum amount in that phase. What's difficult for people to understand is it's not simply what you pay out of your pocket, but the total retail value of these drugs, including what the plan pays and what you pay. And that's what kind of builds up this pot of money that you're spending. And it doesn't take that long to get to $4,430 when you consider a lot of drugs are discounted heavily, and your payment could very well be zero for a number of drugs. Preferred generics many times are zero out of your pocket. Some companies are offering tier 2 generics for zero out of pocket, which is pretty impressive. Unfortunately, most of us cross paths with a preferred brand or a non-preferred drug, or specialty drug, and those are going to actually add up quite a bit. So again, look at the plan. Again, as you're spending down through these phases, you'll get to this coverage gap, which they call the donut hole. Now you're paying 25% period on all your drugs and during the gap up until this $7,050. Again, in total, between what you put out of your pocket and what the plan is covered, and it might be that you've only spent a couple of thousand out of pocket. The rest has been covered by the plan. Again, it's all over the map. You have to look at the plan. And once you pass that phase and you get into the catastrophic phase, your payment for all of your drugs is 5%. Or if it's a tier 1, $3.95, and a tier 2, $9.20. They take the greater of those three amounts out of your pocket. Statistically, people are not, getting that far down the road. Some do, and obviously, knowing what drugs you're taking and speaking to your doctor about what he's prescribing, he or she, based on the cost. And most doctors that are dealing with Medicare and drug plans, they have a feeling for what's going to cost the most. One of the most bizarre parts of this drug coverage world that I've run into in my own life is sometimes a drug can be the exact same drug, generic or not. If it comes in tablet form versus capsule form, it can be as astronomically different the way it's covered. Go figure. It's the same drug, right? One's in a shell and one is in a tablet. So I can't, again, explain why they do that, but beware of the drugs you're taking, because honestly, this will be the most expensive part of your journey as a senior citizen through this Medicare and pharmaceutical landscape that we'll be presented with going forward. All right, I won't cover any more than that. This is part A, B, C, and D in a nutshell. It's 12 and a half minutes. We'll stop here.